So, what's really happening with healthcare cybersecurity? The common story is that big hospital systems are the targets. These are the ones with millions of patient records and deep pockets to pay ransoms. But the reality, it's more complicated. The most vulnerable healthcare in America might be the clinic just down the road from you. In this video, I'm going to share what's actually happening on the ground. First, how a single cyber attack last year paralyzed healthcare across the entire country. In fact, some practices are still digging out, and it hits small providers the hardest. Second, why rural America has become ground zero for healthcare hackers, places like I live here in Fredericksburg. And third, how AI is making this problem both worse and better at the same time. Here's why this matters right now. There's a major healthcare cybersecurity summit happening next month where industry leaders are scrambling to figure this out. There's legislation sitting in Congress specifically about rural hospital security. In communities like mine in rural Texas, the local clinic might be one ransomware attack away from closing its doors. Let's dive in. The common story with healthcare cybersecurity is that it's a big company problem. Massive health systems, insurance giants, the usual targets. But here's what actually happened in February 2024. A company called Change Healthcare got hit with ransomware. Now, you probably never heard of Change Healthcare. Most people haven't. But here's the thing. They process about half of all medical claims in the United States. They're the plumbing behind the plumbing, the infrastructure that connects doctors, hospitals, pharmacies, and insurers. When they went down, it wasn't just their problem, it was everyone's problem, and people are still digging out. The American Medical Association surveyed doctors afterwards, and 80% of physician practices lost revenue from claims they couldn't process. Many couldn't verify if patients had insurance at all. They were calling payers manually, using workarounds, or just hoping for the best. And here's the part that jumped out to me. The AMA specifically called out that small practices, the ones with 10 physicians or fewer, were actually getting crushed. These are clinics that already operate on razor-thin margins. They don't have cash reserves to weather a month of payment disruptions. And a lot of those small practices, they're in rural communities. The federal government eventually stepped in with emergency funding and advanced payment programs. But here's the thing about small practices. Even when help is available, they often don't have the staff to navigate the paperwork. They're just too busy trying to keep the lights on. That's the first wake-up call. When the healthcare supply chain breaks, it breaks the hardest for the smallest players. So here's the second thing that jumped out in my research. When you look at who's actually getting targeted now, it's not the big hospital systems with their IT teams and security operations and dedicated people working on these issues. Hackers have figured out something. Small clinics and hospitals are way easier targets with almost the same valuable data. The numbers are kind of staggering. According to a Microsoft study on rural hospital security, about 2/3 of rural hospitals hadn't fully implemented basic multi-factor authentication. That's the enter the code from your phone security measure that most of us use with our bank accounts. Similar numbers for email security. That's phishing attacks just kind of waiting to happen. And here's the one that really got me. Many rural hospitals have maybe one or two people handling all of IT, including cybersecurity. And by the way, those are the same people usually handling the printers, the Wi-Fi, and whatever else breaks. Now, I live in rural Texas, and when I think about my own community, the clinic where my neighbors go, the small practices surrounding my town, I'm realizing these aren't abstract statistics. This is healthcare infrastructure that serves real people. The part most people miss is this. If your local clinic gets ransomwared and has to shut down for a week or two, what's your alternative? In rural areas, the nearest hospital might be 45 minutes away, an hour away. In fact, in far west Texas, it might be 6 hours away. It could be more. A cybersecurity failure isn't just an IT problem. It's a patient safety problem. It could be a life or death problem. And attackers know this. They know rural hospitals are more likely to pay ransoms because they literally cannot afford to stay offline. Now, here's where it gets interesting, and this is the part where I'm actually cautiously optimistic. You probably heard the doom and gloom headlines about AI making cyber attacks worse, and yeah, that's happening. It's really happening. Attackers are using AI to automate the boring parts of hacking, scanning for vulnerabilities, crafting more convincing phishing emails, that kind of thing. Survey after survey shows that most healthcare organizations don't feel prepared for AI-powered threats, even as they acknowledge those attacks are coming. There's a gap between we know this is a problem and we're actually ready for it. And here's the contrarian take. AI might be the thing that finally levels the playing field for small providers. And think about it. The fundamental problem for rural healthcare cybersecurity is actually people. They don't have enough of them. and they can't compete with big systems for talent. Nobody with serious security skills wants to move to rural wherever it is for a healthcare IT job. But AI doesn't care about geography. There's a concept emerging called agentic AI SOCs. Basically, AI systems that can monitor for threats, triage alerts, and escalate the important stuff to humans. For a one person IT shop at a rural hospital, that's potentially transformative. At the HIMSS Healthcare Technology Conference next month, they've got dedicated sessions on exactly this: how AI can augment a lean cybersecurity team, especially in rural settings. So the reality isn't AI bad or AI good, it's that AI is accelerating everything, the attacks and the defenses. The question is whether small providers can get the defense tools before the attackers can overwhelm them. So let me pull all this together. We covered three things. One, the Change Healthcare attack showed us that when healthcare infrastructure breaks, small rural providers get hit the hardest. Two, rural America has become ground zero because these facilities have fewer resources and the same valuable data as their big colleagues. And three, AI is both accelerating the threat and potentially offering a solution if we can get the tools to the people who need them. For anyone who lives in or cares about rural communities, the opportunity here is awareness. Knowing that this is a real present threat, not something that only happens in big city hospitals. And the risk of ignoring it, the clinic that serves your family might not survive the next attack. There's legislation in Congress right now, the Rural Hospital Cybersecurity Enhancement Act, specifically focusing on building cybersecurity workforces and training for rural hospitals. The healthcare industry is having serious conversations about this at HIMSS next month. Things are moving forward. But in the meantime, maybe check in with your local healthcare provider and ask if they've thought about this because it affects all of us. If this was useful, subscribe for more at the intersection of technology and things that actually matter. I'll see you on the next one.